What's up, world? In honor of World Mental Health Day, we are talking about 5 myths that surround mental illness. But before we get into that, hi, my name is Cameron Lovelace. I'm a mental health therapist and stress reduction specialist that helps make mental health content and stress reduction content to help you reduce the stress in the most important areas of your life, including work, finances, and relationships. So if you love content like that, be sure to give me a like and subscribe for future content. All right, without further ado, let's go ahead and get into the first myth. The first myth that I want to address is that you are weak if you go to therapy, or strong people don't need therapy, strong people don't have mental illness, and this couldn't be further from the truth. Because mental illness is no respecter of person. First of all, when it comes to the idea of mental health, you gotta look at it from a health perspective. Just like if you get the common cold, that doesn't make you weak. It doesn't make you weak if you struggle with anxiety, depression, bipolar, XYZ. That is just your health concern. So it's not a matter of being strong or fortitude, different stuff like that. And honestly, that idea of that might be wrapped up in toxic masculinity or, just trauma. But, that's another video for another day. Struggling with mental illness, going to therapy, it absolutely positively does not mean that you're weak. Actually, it probably means that you actually are strong, because there are millions of people who avoid going to the doctor. There are millions of people who avoid coming to therapy. So the fact that you are willing to step in the office and actually address your issues actually means that you're willing to man up, woman up, and face the issues that you're dealing with head on and work towards them. Which leads me to number 2. There is nothing you can do about mental illness. Could not be further from the truth. Just because you struggle with something like depression, anxiety, family issues, trauma, doesn't mean that you have to deal with that forever. You can actually go to therapy, meet with a mental health professional, and actually, one, acknowledge it, get more tools about it, get mental health strategies on how to deal with it. You can take medication, go to a psychiatrist so that your symptoms are much less severe. There you can build a community, you can go to group therapy. There are so many different things that you can do to address your mental illness. And it's not even limited to the stuff that I just said. You don't have to be a victim of your mental illness forever. A lot of people think that, but that's just because they don't understand that mental health is the aspect of health. So if you look at it from that perspective, really from a holistic perspective, then you are able to see, okay, there is a solution to what I'm dealing with. Number 3, people with mental illnesses are violent. Now, this has to be one of the biggest myths because of the way that people with mental illness are portrayed in the media. So, of course, there are big time movies like Split, Dr. Glass, what are some other movies? But there's a ton of movies, especially horror movies, with people that have different mental illnesses eventually becoming violent. Now, the mental illness does not make you violent. It is the circumstances that create violence within a person, like pressure breaking pipes. When you push somebody to the breaking point, they can become violent, they can have outbursts, and it just goes from there. It's not because of the mental illness. Now, when it comes to each individual, yes, when they are having an episode, yes, when somebody's having a really flare up of symptoms or different stuff like that, maybe they can become violent. But again, this is not because of the mental illness, but rather because of how the person is not choosing, but how they are accustomed to breaking out. Just like a completely sane person can commit murder, a person who is suffering with mental illness can be the most peaceful person, non-violent, non-interactive person. So it is not because of the mental illness that somebody is violent, and it doesn't equal violent. Number 4, people with mental illness cannot be successful. Now, this one is kind of actually near and dear to my heart, because I actually have a lot of clients who maybe don't want their mental health struggles to be documented. So they avoid telling their doctor, they avoid sometimes telling me, the therapist, about previous diagnosis, because sometimes that diagnosis that they're slapped on with at age 12 or age 15 or age 20, it can follow, they think that it'll follow them and, prevent them from getting more opportunities. So to directly address it, you can have mental illness and still be successful. Absolutely, positively. The thing about it is, you got to know how to manage your particular circumstances. It's just like when a person who is in a wheelchair, whether their legs aren't working or they don't have legs at all, they just have to make different adjustments in life in order to be successful. So obviously they're not going to be doing track and field, but they're going to focus on strengths that they can do. So maybe they're good at computer jobs, maybe they're good with their mind, maybe they're good at arts and crafts. So it's about finding your lane that allows you to be successful in and making the adjustments. So let's say, for example, the most common one, depression. So depression is all about your loss of interest, low motivation, sometimes extreme sadness for no reason, different things like that. So you have to know how to manage your symptoms. So for example, from changing your diet, making sure you get enough sunlight, making sure you get enough vitamin D, making sure you have enough dopamine flowing through your system through your diet, exercise, medication, different things like that, so that you can go to work 5 out of 5 days in a week. You know what I'm saying? So it's not that they cannot be successful, it's that people with mental illness have to learn how to make the adjustments so that their mental illness doesn't get in the way of their work. But that's just like any other issues, from diabetes to arthritis to high blood pressure to, unfortunately, smoking cigarettes. You have to make the adjustment with your particular condition. All right, number 5 is dedicated to my religious people, and that is, you can just pray mental illness away. Now, don't get me wrong, I love Jesus. I'm a devout Christian, if you want to slap a label on it. But the thing about illness in general is that, yes, miracle signs and wonders can happen. I absolutely believe they happen. But when it comes to any kind of illness, there is medications, there's interventions, there's support with people that can allow you to deal with it here on earth, so that God doesn't have to move mountains for you to happen. And another thing, sometimes your mental illness is more than just you having an anxious moment. It's more than you just having a singular episode. Sometimes it's the result of years and years and years of issues, traumatic engagements, and environmental circumstances that are causing the mental health issues to flare up in that particular instance, that you need to address first before we call heaven. Because God can come and save you in that moment, but what about tomorrow? What about the next day? What about all of that needs to be healed and restored and nurtured and cured on a daily basis? So don't look at mental health as just something that you can just fix in one instance, because 9 times out of 10, you didn't get that way overnight. Like, people didn't just wake up, come out the womb bipolar. People don't necessarily wake up, become ADHD. Sometimes it's something that the brain, the body, the circumstances has developed over time. And so with that time, you got to put in sometimes an equal amount of time to deal with it. I have to tell my clients all the time, listen, you've been dealing with this for 3-5 years. It's not something that we're going to solve in 3 sessions. It's going to take some time. So a bonus myth is mental health is only limited to white people. That is absolutely, positively false. Black people can get depressed. Brown people can get anxiety. All of the type of traumatic experiences can affect anybody. That's why for World Mental Health Day, it affects everybody. Everybody goes through tough time. Everybody goes through traumatic circumstances. Everybody goes through little t and big T traumas. It affects us all. It is not limited to just a race of people. And with that being the case, as a culture, you and I have to learn how to have mental health conversations very casually. It's not something that we need to avoid talking about. It's not something that we need to ostracize or point out when somebody's going through something. It's something that we all have to integrate into our conversation and make it normal. All right, guys, if you enjoyed that video, make sure you leave one big thumbs up and subscribe for future content about mental health and stress reduction tips. Until then, I will see you guys on the flip side. Peace.